My name is Dr. Mariam Tanveer, and I welcome you all in this online foundation course for pre-dental students. I'm responsible for the module 2, which is about the introduction to basic of dental materials. The learning objective for these sessions are: at the end of the second module, student of the online course should be able to understand the different types of dental material used in dentistry and classify the dental materials. So, what are dental materials? The science of dental material involves a study of the composition and properties of materials, their interact with the environment in which they are placed. As you can see in the picture, there are different materials having different consistency and different texture. These all are used in dentistry in different places, and they have different uses, and their physical properties, their mechanical properties vary accordingly. The selection of material for any given application can thus be undertaken with confidence and sound judgment. When a dentist or dental hygienist or dental assistant use any specific material, then they should know what work that dental material can do. What are their physical properties, what are their mechanical properties, what is their boiling pressure, what is their setting time. They should have an adequate knowledge of all these properties of particular material they are going to use, and above all, they should know which material should be used at what place, which material should be used intraorally, which material should be used extraorally, which material should be used for fabrication of a model, and which material should be used for fillings. So on the basis of that, we have jot down some characteristic of ideal dental materials. An ideal dental material should be compatible, should bound permanently to tooth structure, should match with the tooth structure and other visible structure, and be capable of initiating tissue repair. Now the question is, that every material is ideal? No. Or every material should have these qualities? I would say that it is not necessary that every material which we are using in dentistry should have all these qualities, because if we are using a certain material which is used outside the mouth, then it doesn't matter if it matches with the tooth structure or not. Same thing, if a material which we are using outside for making cast, it should not, if it's not biocompatible, even then we can use it for fabricating the cast, as long as we are not using that material into the mouth. Same thing happened to every material cannot be used for tissue repair. Only the cements and the lining, they have this property. That is the reason they are used as liners and cements. Everybody is following me, everybody is with me. So moving forward, we have classified dental material on the basis of its use, which is I was talking about in the last slide. So according to the use, we have classified dental material. If it is using in preventive as a source of preventive measure, if it is using as a restorative, then it is called restorative dental material. If it is using outside the mouth for fabricating, for making, for taking for taking bite records, for making a cast, for taking impressions, then they are used in auxiliary. In auxiliary dental material, usually etching gels are used, and wires are used, wax are used, and we will be discussing it in the following topic. So preventive dental material. Preventive dental materials are the materials which are used to arrest or cause prevention of teeth. And likewise, when we say that a material which can stop the caries, at that point they are called pits and fissure. We have little pits and fissures in our teeth. The material which are used to seal those pits and fissures are called preventive dental materials, and material used primarily for antibacterial effects. The examples for preventive dental materials are liner, as I have talked earlier, liner, bases, cement, restorative, which releases fluoride and used therapeutically. Some bases and some liners also use as a lining material in the deep cavities, where they initiate the secondary and tertiary dentine formation. Chlorhexidine are also used as therapeutic agents. In this picture you can see we have little pits and fissure in our teeth, and these pits and fissure are used on those anatomical structures to seal those places, so that we could prevent the exposure of cavity into the tooth. We can limit the exposure of cavity or caries, and we can prevent the tooth decaying by applying pits and fissure. Now come to restorative dental material. Synthetic component that can be used to replace tooth structure are used in restorative dental materials such as amalgam, composite, and compomer. Amalgam is not used nowadays as because it is associated with mercury hazards, and nobody wants a live something in their mouth which can give them bad effect on their health, or can affect on their health and their teeth. So nowadays, which the material which is is used often is composite and also compomer. Compomer is a combination of glass ionomers and composite, and it has the quality of composite and glass ionomer. In this picture you can see they have used this like they have made fabricating a cavity outside the mouth, and they are going to put it inside. These are they can use composite in the cavities and compomer in the cavity. Now come to the auxiliary dental material. Substances used in the process of fabricating dental prostheses, as I have discussed earlier, and dental appliances. For example, impression materials, dental waxes. This is a picture which has a different kind of waxes in it, different kind of impression materials in it. Another other auxiliary materials, materials which we use in dentistry are gypsum cast, finishing and polishing abrasive, acrylic resins for impression. In order to summarize it, I would say it's not only the work of a dentist, but it's a teamwork of a specialized dentist, general dentist, dental assistant, dental hygienist, and dental technician to provide good oral health services. The knowledge will make them unable to select and handle the appropriate materials for the given clinical situations, and also ensures optimal properties of the material. Understood this session, and if you have any queries you can email me, and you can ask me in the discussion forum. I'll be uploading some discussion forums, so you can ask questions. Any questions if you have, you can just post your queries there, and I'll be there to help you there, and I will answer all your queries. Thank you very much.